Sexually transmitted infections are very important, and there's a lot of them in Singapore and the region as well. And so in trying to address policy such as how effective, how cost effective would a particular intervention be, such as partner notification or screening of high risk groups. There are two main options for how to try to evaluate this. One would be to do a randomized controlled trial, but they're very expensive and they can take a long time. It's not clear that it would be ethical. The other one is to use mathematical modeling, which is a much cheaper, not as rigorous, but it's cheaper and quicker. Now, the issue with mathematical modeling of STIs is that they are very often built on quite shaky foundations. And so the numbers that are in the model often have no basis in reality. So what we're going to be doing in this proposal is to develop a new method, a simulation-based method, for appropriate and rigorous parameter estimation for STI models. I expect it will have very little visible impact, but a large impact behind the scenes by filtering out our ideas to modelers both in Singapore and around the world. Then their models will become more rigorous for policy making, and this eventually will have an impact that you can detect. It's very relevant to NIHA's objectives. So STI models are naturally very complex because sexually transmitted infections are very complex. And so being able to understand them requires bringing together expertise from different disciplines together. At the moment, the tools do not exist for rigorous estimation of these models, and that's what we will provide.